Good afternoon, and thank you for being here again today. And I would also want to thank an extended personal thank you today for the Missouri National Guard. They've been in here this week while the legislators have been here working the doors and helping with that, along with the many other duties they've got across the state. And every day I just appreciate the men and women that work for the Missouri National Guard and the jobs they do every day. So I want to take time to thank them today. The data continues to look more positive for Missouri, and I want to review some of that data with you again today. Missouri has tested over 124,000 Missourians since the COVID-19 pandemic began. Last night, I read a report where Missouri had 10,000 positive cases. That is inaccurate information, and I think the public needs to understand that. The 10,000 number is a cumulative total since we started on March the 7th. And I will keep repeating that because I think it's important everyone knows that. The reality of it is most of those 10,000 have recovered or are recovering. There's about 9 to 10% that would still be affected with that. So you can do the math on that, but the majority of those people have recovered from that. So I just want to make sure that everybody gets that information. It's not misleading, that everybody in Missouri understands that those numbers. That is Missouri's total. Many of those positive cases have been recovered or are recovering. And today we had an increase of 136 positive cases. The deaths are at 542. And again, saddened for every family member and every friend who have lost a loved one. Testing has been a primary focus of the pandemic. We knew testing capacity would give people the confidence needed to get back to a more normal. My administration and I have worked hard to get our testing in a good position. One of the major pillars to reopening Missouri is expanding testing statewide, which we have been doing and continue to work to increase capacity. As we build the state's testing capacity, it's going to be critical to strategically deploy new testing resources. This includes tests for comprehensive testing of symptomatic and asymptomatic people among outbreaks and antibody testing to look at disease prevalence. Therefore, a cross-agency working group has identified a number of priorities of how the state of Missouri can prioritize and deploy testing resources that flow through state administrative channels. These priorities include the early identification of possible outbreaks through the use of community sampling, sentinel testing, and for vulnerable populations. The rapid deployment of testing supplies and support resources as localized outbreaks are identified. Expanding access to testings for vulnerable populations, healthcare workers, first responders, workers in critical industries, and long-term care facilities are extremely vulnerable. And we plan to move on the box-in strategy for these facilities. Just as critical as the testing supply themselves, the support functions around test collections, the staffing, the PPE, and the need for contact tracing are critical. The cross-agency team working on testing and building plans to address those challenges. We also know that primary care providers will play a critical role in recommending citizens for testing. It is essential that doctors and clinics review the expanded testing guidance put out by the Department of Health and Senior Services to ensure not only that we've identified new cases, but have helped individuals get tested who work in essential industries and whose employers may require tests before they can return to work. It is also very important that Missourians who have symptoms or who have had close contact with a confirmed positive case to contact their local health care provider to discuss testing options. To protect our families, our businesses, and our citizens, we have to ensure access to testing and follow responsible social distancing requirements. Today, we are fortunate to have Jim Dumbald here, a senior director from Quest Diagnostics, with us today. Quest Laboratories has been an integral part of bringing testing capacity to Missouri. We have talked about Quest, it seems like, a lot in our briefings early on about these companies, and I can't tell you what that's meant for the people of the state of Missouri and what they've brought to the table here for us in Missouri. But we're grateful for Jim's here today. His wife is also with him today, that's out in the audience out there, a retired school teacher, so we're glad she gets to be part of this. But we're glad to have both of them here. Jim?
Thank you, Governor. I appreciate it. First off, I would just like to thank Governor Parson, as well as his staff and the citizens of Missouri for the support that they've given us, Quest Diagnostics, in terms of the testing and our ability to service Missourians. You know, we look at testing sort of as a team sport, or look at it in a way that is like a team sport, and that is it takes the collaboration of a number of people to make sure it happens correctly. And so whether that's public or private sector, working together does help the situation and help us through the crisis. We're proud to be an integral part of the community in Missouri. We have over 1,200 employees working in Missouri. We have 34 patient services centers. Last year we did over 900,000 tests in Missouri alone. Missouri, we have over a dozen relationships with hospital, healthcare systems, community health centers, and the VA hospital, just to name a few. Fitzgibbon Hospital, Mosaic Life Care, Truman Medical Center, Mercy, State of Missouri Department of Health and Services Community Study, St. Francis Medical Center, Affinia Health, ESSA Health, Total Access Urgent Care, Freeman Health System, Harry S. Truman VA Hospitals, and finally a Jordan Valley Community Health Center. You know, a little bit about Quest Diagnostics in terms of the logistics, my function. I actually serve over 1.3 million square miles in the United States, 19 states. I have over 800 vehicles running in those states, making pickups of our specimens and bringing them back to our testing labs. I have 9 aircraft that we own and operate that help us move those specimens in those 19 states. And we've made over 3 million stops, that's a client visit, each year. And we travel over 26 million miles per year. So we're kind of in and around, and we really lubricate the methods in terms of collecting specimens and getting them into our labs for testing. You know, nationwide, Quest has performed over 1.5 million COVID-19 diagnostics tests since March 9th. And we are currently have a capacity of over 50,000 tests per day, and we're ramping that up as fast as we possibly can. We hope to be at somewhere in the neighborhood of 100,000 within the coming weeks or month. So we're really trying to support Missouri as well as the nation in terms of our testing ability and the ability to get through this crisis. I would like to give thanks for the opportunity to speak here to the citizens of Missouri. We're honored to support your efforts, and stay safe, and we're happy to be part of this journey. Thank you.
Jim, thank you. Thank you again for being here today. For all of us that didn't know much about Quest or knew about testing before this all started, as many of you here today have walked your way through this and learned as we went. It was so important for those companies to be out there that we could rely on, that stayed functional, stayed working every day to make sure we could keep accumulating those tests every day till we get better and better at it. So I thank the companies that were out there on the front lines working every day to try to get those tests back as soon as we could. You know, testing is and will continue to be a key ingredient to moving forward. Missouri is moving in the right direction. Tomorrow, I am heading to the southeast part of the state to see how they are gradually reopening businesses and industry. And I will also get the privilege of thanking law enforcement officers for their dedication and commitment to the people of this state. We must continue to remember to social distance and use good common sense if we're to win over this virus. I told people earlier today, some of the people I'm on the phone with, the one thing I do know for Missouri to move forward, and I've said it time and time again, but I'm going to say it another time. In order for Missouri to move forward, we have to be able to fight this virus, and we have to be able to get the economy going at the same time. Those two are going to go hand in hand, and we're going to have to do that for a longer period of time than maybe any of us want, but those two things have to go together. So thank everybody for being here today, and God bless Missouri and the people of this state. Kelly?
My question is for Jim first, Mr. Gumbel.
Thanks. Sure.
All right, Crystal from the Kansas City Star.
Hello. So you said that Quest does 50,000 tests a day. Do you know of what percentage of those tests are just Missouri tests?
Actually, I don't have those figures at hand. We do approximately, 50,000 or can do 50,000 across the country, but I don't have the exact Missouri number.
Are you pretty much at your maximum capacity for testing, or can you expand more if you needed to?
No, we can expand more. Currently, we're a little bit short of our maximum capacity right now. We do move testing around to maximize the throughput at our labs so that we can achieve a good turnaround time on testing. But we plan on ramping up our testing, as I mentioned, in the next weeks, in the next month, to what we hope to be 100,000 tests a day.
Hi. So you say the capacity right now is at 50,000. Are you doing, and you say you can do that amount. How many tests are you, do you per se, you're pretty much doing right now?
The last number I saw was actually from Monday, and I believe it was about 48,000.
All right, thank you, Mr. Gumbel.
Thank you.
Director Williams?
Yes.
Hi, Dr. Williams.
Hey.
I had a question based on what Governor Parsons said, that we have just over 10,000 cases and about 542 people have died. That would be at a death rate of about 5%, correct, if my math is right? I know that's of people tested, but does that seem unusually high?
Well, we look at it per capita is the way we do it, and we look at it compared to other states. And so the last time I looked at it, we were below average in the United States for deaths per capita for the number of people, if that answers your question, as opposed to deaths per number of tests. We track that every day. It's on our website. I believe you can see it with the new robust website. It's deaths per capita. I just want to add, just cannot thank Jim for being here and enough for what they do. As I've said before, I think that public health at its best is a force multiplier, and it was always our strategy to emphasize testing and to use our commercial labs. And so the question Jim asked, we watch it I see every day how many tests Quest does in Missouri as opposed to in the other 17 labs. And their days, they do 3,000 tests a day in Missouri. Their average is probably around 1,000 to 1,500. Not right now because our cases are so much down. We've had 74 on Monday, 86 on Tuesday, and 136 today. Also, part of that, as he pointed out, is our hospitals. This is National Hospital Week. And the governor and I were on a conference call, as we always are on Wednesday for the last 10 weeks or so, with our hospital partners, and just cannot thank our labs and our hospitals and our local health departments and our more than 150 testing sites for getting us to where we are to do the robust testing we're going to do and be doing more so in the future. As the governor said, people say public health or economy. That's a false choice. They're both correlated. You have to have a good economy to have good public health, and you have to have good public health to have a good economy. Those are very much intertwined and integrated, and that's very much our thought going forward.
Between all the labs in the state, what is the current daily testing capacity in Missouri?
Well, capacity right now, I look at it every day, we're over 60,000. It's about whatever 7 times about 8,800 is when I looked at it this morning. And I just got off a phone call with Admiral Giroir at the White House about an hour and a half ago. He said that, he mentioned Quest specifically, that they believe that they will increase their testing capacity nationwide 500,000 tests a week. I believe it was by next week. And I think I've heard some questions about testing materials. As you know, we got 29,000. Crystal had asked me about that, and I think we told her we got 29,000 swabs on this weekend. We've pushed the majority of those out to hospitals to help them as they open back up. And we've been told that we will get those every week now for the next coming weeks. Admiral Giroir said on the phone today that in the month of May, they will send out to the 50 states 9.9 million swabs. And so every week we will be reporting out how many more swabs we get.
So when you say 7, you mean 7 days and 8,800 tests per day?
Yes.
Okay.
Mm-hmm. Mm-hmm.
Hi, Dr. Williams. I was just wondering what you know about inflammatory syndrome in children and how many cases have been treated in Missouri?
I don't know the exact number. I know we've had some in Kansas City. They've had 150 in New York, I believe. It's an interesting, it's thought to be associated with COVID-19. It's an autoimmune reaction. We've seen it in other diseases, one called Kawasaki's. And it's basically where your body reacts to itself. It reacts to an antigen and starts attacking itself. And we've seen that in some other conditions like Kawasaki's disease in children. And it's there's not a cure for it. What you have to do is go in and just try to support the body till it can recover from the autoimmune attack of attacking itself. But I don't have an exact case count in Missouri, but we have had some cases in Kansas City and in St. Louis.
Is there anything that parents can do to maybe protect their kids at this time? I know we don't have a lot of cases.
Yeah, not that I'm aware of. One thing we looked at, less than 2% of our cases in Missouri have been in individuals under age 20. So right off the bat, we're thankful that the denominator of children affected is so low. But what it is about, every parent would want to know. I remember when I practiced medicine, why my child? Why did my child get this incredibly rare thing? And to date, I don't think we have that answer.
Hi, Dr. Williams.
Hey,
could you just sort of summarize for Missourians what the strategy is for using testing in the best way possible going forward for the state?
Yeah, I think the governor summarized it great. The first is we've expanded our testing criteria. So if you're symptomatic in any way, or if you're even asymptomatic, but I was out in Affinia on Monday, and people were coming to get tested. I said, why are you getting here? He said, well, I had a loved one who had it, and I'm worried about it, or I work in a healthcare facility, and I want to get checked. So these people were out in a parking lot on a Monday afternoon or Monday morning, and we tested them. So we want to test all those people. We have the capacity to do that now if you have that concern. The second bucket is going to be this boxed-in strategy, where we go into long-term care facilities. We're changing our criteria. If you have one patient who turns positive or one staff member who's symptomatic who turns positive, we're going to go in and check everybody. And we're going to do the same. We're going to also be doing very similar in our prisons, jails, meatpacking facilities. So you've got that bucket that we're going to be doing. And then we're also going to be doing, as the governor said, sentinel testing. As we get into June and July, and we're going to have less cases, I believe, we're going to go into our long-term care facilities and our meatpacking plants and pick sporadically groups to test, 10% of the people, just to see, as the governor said, are there any things developing that we need to check? Because one thing we learned in Triumph is there are people who walk around asymptomatic, and we want to see if we can figure out who that is before it is. The next bucket is prevalence testing, where we will just go into communities like we did 2 weeks ago, all across the state, and just check people and see what is the prevalence in Missouri in mid-July. And we'll use antibody testing for that, and we'll also use PCR testing. So it is broad, it is widespread, and it's going to be incredibly robust. And we think that gives us the confidence to open up the economy and to keep people healthy. Because as I said before, and the governor has said many times, they're related. They go hand in hand. To have a good economy, you need healthy people. To have healthy people, you need a good economy. Thank y'all.
To piggyback off of Jeff's question, actually, will there ever be a time? The strategy you just described sounds like you'll be going into specific areas to kind of facilitate the testing. But will there ever be a time where residents of Missouri could just get a test if they want to see if they've been exposed to the virus, have the antibody? What would that look like?
Yeah, I think, by June, July, if you want to go in and get an antibody test validated by the FDA, you'll be able to. And I think many people do it. I will do it. I'll go in July or so just to check and see. Now, you're going to hear people say, well, we don't know that conveys immunity. But most of the time, we believe with other disease states, if you have antibodies, that's a positive thing. And I think I quoted to you the study from Mount Sinai 2 weeks ago that showed even people with mild disease, who just are barely sick, if you wait 3 weeks, the vast majority, 99%, will have an antibody response.
In the scenario that you were posing about someone being worried about exposure to COVID and being able to get a test, in that scenario, would a person still have to contact their primary care doctor to have a test ordered, or would they be able to go to a public health department and get a test?
Yeah, Crystal, it's changed. I mean, right now, the FDA's approved an at-home test. Pretty soon, you're going to be able to do your own test. Matter of fact, if you can get one now, it's been approved by the FDA. So you're going to see that coming forward. You're seeing saliva testing. We don't think that's quite as accurate as the nasal swab, but you've heard people talking about just doing the cheek yourself and doing your own test. So I think the day's rapidly coming in the next 2 or 3 weeks where you'll have the ability to test yourself. We probably would recommend the nasal swab instead, but I think you'll have that capacity, and I think within the month, anybody who wants to get an antibody test will be able to get one, a blood draw, and just see what your status is. Yeah.
Hi, Dr. Williams.
Yes.
You mentioned the prevalence testing. I'm just kind of curious,
Yeah.
how, when you go into a community, one, how do you select the certain community, and then how do you select the people? Like, do they volunteer, or kind of what's that process?
Yeah, it's a good question. It's epidemiologic, and what you do is you go in and you do a cohort, and so you start look. It's like polling, where you try to find a representative group of people by demographics, and that would be race and age and sex, that represents an area, and you say, we think these 500 people are representative of 100,000 people. We're going to specifically check them for their demographics, and then we'll extrapolate from that what the prevalence of COVID-19 is. Is it 5%, which some people think it is, that have antibodies? And so it's different than what we did earlier, which was just a snapshot. We did not match people up by demographics. But in a true randomized prevalence study, we actually are extrapolating from them what the broader population looks like. And our plans are to do that in about 3 weeks, I think. Thank y'all.
Just one thing to add on to what Dr. Williams just said too about testing. As these numbers grow, and it's going to be more apparent that people are going to be a lot more available to get a test. But I think it's also important to remember the demand for testing has also went down as far as on the private sector, unless you're in kind of a hot spot or some of the things we're doing. So I think that's important as we move forward and things get a little better. I think people are going to be less likely to want to be tested. The good news is, though, we're going to be very aggressive on the testing from our part of it, trying to push those testings out to make sure that we get those tests done. The other thing, when Jim was up here from Quest talking about testing, we had one company that was up here, and I think as today we talked, we're probably utilizing 7 or 8 different companies for testing along with the state lab. So those numbers, when you hear what Quest is doing, then you look at all the other companies that are doing that the hospitals may be using or the private sector may be using. So those numbers are growing every day as we do that. So, questions?
Governor, there was a widely reported federal government document that noted that Kansas City might be a hot spot to watch for coronavirus cases. And so the document identified Missouri as a place where new coronavirus cases had grown on a week-over-week basis, or 31%. Do you know what accounts for the growth in Missouri cases, and given the increase in cases in Missouri, does that give you any pause about loosening restrictions and reopening the economy?
Yeah, well, first of all, I wouldn't put much stock in a report from outside the state of Missouri, which we've proven all through this process that most of that's inaccurate information. So I don't know what study you're referring to, even how accurate it would be. I do know this: Kansas City's done an extremely good job of taking care of the coronavirus up there, as you can see, compared to other cities its size, and you can compare it to St. Louis. They've done a good job up there. So the mayor, their health department, and the people up there has done a really good job in that Kansas City region. Not to say they didn't have problems like everybody else, but they're well on the way to recovery, and I think if it keeps going, you got to keep that in mind. Here's the other thing: there is going to be spikes from time to time, and this is going to happen. Whether it's a nursing home, whether it's people congregate, that's going to happen eventually, sooner or later. But this virus is still out there, and I want to stress that to every day. That's why social distancing is such an important part of how we fight the coronavirus. You have to keep that in there. But Kansas City's done a good job for their size. I think they're very fortunate. They've done a good job up there.
Just to follow up with the inflammatory syndrome in children, is that a concern for you as we're starting to reopen and kids may go to summer camp, but in the fall as the school year approaches?
Yeah. I mean, with the Department of Health, we're looking into that right now because, we're concerned about all that. We've been very fortunate so far. It hasn't affected our children like we thought it was. And again, I go back to when this all began. None of us knew who it was really going to target so much. We didn't know whether it was going to be, whether it's our seniors with underlying health issues or whether it was going to be children or middle-aged. We didn't know. We do kind of know that now. So when we see something like that, again, that's one of those daily things I talk about change. So we want to check in that and get as much information as we can, as I know other states are too. But anytime we start seeing a different spike than we've seen, we're always taking a look at that, and we want to try to find out, get to the bottom of it as soon as we can, to prevent it or do whatever we can from our perspective to help with it.
Governor, we're beginning to see universities in other states cancel their in-person classes for the fall. Is the state here giving any advice yet to our universities on that?
We have not. You know what? I actually plan on meeting with the president, the universities, the community colleges, DESE in the next week or two to talk about different things, to talk about funding and talk about how that fall might look. Again, I think it's early. We're at the middle of May, but we still got to be able to look and see how this is going to affect the state and how it's going to affect our citizens and how that's going to be. I'm not for sure we got the information we need to make that decision right now. I think come June the 1st, you're going to get a little clearer picture of what's going to happen in the state, whether we're going to have school as normal or what we're going to do. But again, it's just going to take a little time to really realize where we're at on opening up schools and things like that.
In terms of the state budget, I know the lawmakers mentioned that they left some flexibility in the budget for the federal dollars, but I know at the federal level there's also talk about more stimulus money. Do you anticipate a special session being called later in June or this month?
Well, it all depends what the federal government does, if they do anything. From here at the governor's office, we got Plan A and Plan B. Plan A right now is moving forward is that we're not going to get any more federal money. So we're preparing for July, what those withholds might look like and what we're going to have to do here in the state. And the second thing, again, depending on what the federal government does, if they do anything. We'll see what that backfill is. But I don't know it'll be a special session because I just don't know what that is right now. Hopefully we'll be able to address that issue. If not, look, we're going to have to withhold hundreds of millions of dollars by July the 1st if we don't.
This is the last week of legislative session, and the lawmakers are working beyond the budget. Do you have any comments on things that they are doing or sessions so far amid the coronavirus?
Yeah, one of the good things that they got out early, I understanding, is reciprocity. That's probably going to be a national leader in what we did on reciprocity for our state. We did military reciprocity, was one of the first issues they got out. They got full reciprocity out. I think that's a much bigger deal moving forward than maybe people realize now with the coronavirus kind of being in that front page of the news, I guess. But the reality of it is they got that done. I know they've got a couple other bills done so far. I'm not sure what they'll finish at the end of the line. You're in the last 2 days of session, and I've sat in those seats before. There's a lot of things will happen tomorrow and Friday, or nothing will happen. I don't know which. But anyhow, it's a little early to kind of try to figure out what's going to make it across the finish line. And I think it's also important for especially the people, watching this today, to realize just because something gets passed in the legislature, you don't know what all's in that bill. And I've always been hesitant to say, would I sign a bill, would I not sign a bill until I see what all's in it. Because, there's basic things they got to be. They got to be constitutional. They got to, make sure there's not a Hammersmith problem in there. So we'll discuss that after the session's over and see what ends up on my desk.
You mentioned we need to fight the virus, but also kind of stimulate the economy. And on Monday, you mentioned we need to focus on how to create jobs.
Right.
I was wondering, what type of jobs do you anticipate will be created?
Yeah, well, I think things is you may have things like right now, online services might expand. Deliveries may expand to a different modes out there. Healthcare may be a different way we give healthcare to people out there. So I think whether it be telemedicine, I think different things with technology will probably change the way we do business. So I think that'll be opportunities for people to be able to look at that. I mentioned yesterday that we were really excited about when actually the federal government called and was talking about manufacturing in our state of Missouri, making PPE supplies and gear. That we were kind of I want to say a leader in the United States when it come to the Google Marketplace that we developed here, and it really combined our medical teams with our manufacturers. So that become a little bit of a model the rest of the United States is looking at. So I think there's opportunities for manufacturers to come in to make PPE gear. I think whether it's technology, we're going to change the way we do business. But you know what? I firmly believe people are going to go back to work. Businesses are going to want to come to Missouri. I can tell you, as of last week, we got a call from a business of about 160 people in Illinois. Believe me, they want to come to Missouri, and they're trying to figure an avenue how to get here because of just what's happening over there and some of the things they're going to. So I think there'll be opportunities with it. Slow going, but I think you'll see people come, and I think Missouri is just a solid state where people's going to want to do business in this state. All right, thanks everybody for being here today. Thank you.